What happens if you catch the new coronavirus? Here's what we know so far on what COVID-19 does to the human body in cases of infections and deaths. A deadly new coronavirus that emerged in China in late December has spread to more than 160 countries on 6 continents, with the World Health Organization (WHO) declaring the pathogen a global pandemic. On March 19, the death toll from the virus has surged past 10,000, and the number of reported cases is over 246,000 globally, according to Johns Hopkins University. The majority of cases were reported in mainland China, but the rapid advance of the infection known as COVID-19 has triggered worries across the globe. As fear spread, scientists and researchers around the world ramped up efforts to understand the new virus and how it affects the human body. The new virus belongs to a family of viruses that can cause respiratory illnesses in humans, ranging from the common cold to more severe diseases, such as the Severe Acute Respiratory Syndrome (SARS) and the Middle East Respiratory Syndrome (MERS). Thought to have been transmitted to humans from an as-yet unidentified animal source, the new virus spreads primarily through respiratory droplets, such as those generated when an infected person coughs or sneezes. On average, it takes about 5 to 6 days for someone to show symptoms after becoming infected. However, some people who carry the virus remain asymptomatic, meaning they do not show any symptoms. The virus multiplies in the respiratory tract and can cause a range of symptoms, according to Dr. Maria van Kerkhove, who heads the WHO's Health Emergencies program. You have mild cases, which look like the common cold, which have some respiratory symptoms, sore throat, runny nose, fever, all the way through pneumonia. And there can be varying levels of severity of pneumonia all the way through multi-organ failure and death, she told reporters in Geneva on February 7. However, in most cases, symptoms have remained mild. We've seen some data on about 17,000 cases, and, overall, 82% of those are mild, 15% of those are severe, and 3% of those are classified as critical, said van Kerkhove.